My name is Mandy Van Dyke. Today is January 11th, and this is my daughter Ashley, and she will be my patient for this assessment. Um, I would gather all my tools before I came into the room. I would wash my hands before I came in for sanitary reasons and to ensure that my hands would be warm for the procedure, or if there's a sink in the room, you'd wash them in there. So there are some things that I do not have a reflex hammer, which is one of them, so I'm going to lightly attempt with this miniature hammer that I have. So I have all my supplies gathered. I would start with a general summary assessment. I would say something or document something to the effect, and of course as the patient walks into the room, or if I called them in there, you could assess the gait, observe the gait for any abnormalities. You'd say something to the effect of, this patient appears healthy, has a steady gait, is well groomed. You could obtain their weight and height at this time. Weight is approximately 140 pounds. Her height is about 5'3". She is a 20-year-old female who appears well nourished and healthy. Just a general observation at this time, you can tell that her overall condition is healthy without any abnormalities. I can introduce myself to her at this time. Hello, Ashley, my name is Mandy. I will be the nurse with you today. I'd like to start by asking you a few questions. Are you having any problems with your health at this point?
No.
Okay, can you state your name for me?
Ashley.
Do you know where you are?
No.
Can you tell me where you are?
In Mountain View.
She's a bit shy, so hang with us. And can you tell me the time and the date?
5:30. January 11th.
Okay, good. And from here, this is where you could just begin to inspect the integumentary system. Of course, if you're in the clinical setting, you'd offer them a gown or a blanket to provide privacy and their dignity, and that way you just expose one area at a time. At this point, that she's just wearing a tank top and some shorts, so I can assess her skin. Her skin appears to be pink. It's dry. There is some dryness noted throughout the elbows, but nothing abnormal, just normal for this time of year. She does have freckles noted throughout, maybe more sunspots, the occasional scar here and there. Are those scars from surgeries, just any accidents or injuries?
Nope.
No, just can you tell me how they happened?
Small scratch.
Okay. All right, and you can inspect the turgor at this time, but you can do that just by pinching the back of the hand for a few seconds and letting go. It snaps back promptly. Patient appears well hydrated. You can also do this on the chest in the elderly or on the forehead. We'll do that on the other side. You can also look at the nail beds at this time. Her nails appear well developed. They're smooth. They're slightly rounded. The hygiene is good. They're well trimmed and clean. Few hangnails noted, but again, that's probably due to this time of year. None of them appear infected. You can just barely squeeze the end of the fingertips for capillary refill, the vascularity. It is within normal limits, less than 3 seconds. Again, you can do this on the feet. Check the turgor just by tenting the top of the foot gently, taking care not to pinch. The skin turgor is within normal limits. It bounces back quickly and promptly. At this point, she does have red nail polish on. In a clinical setting or hospital setting, you could remove that to check for vascularity, capillary refill. At this point, I'm just pressing the edge of the toe. I can see that it does blanch and the refill is prompt within 3 seconds, less than 3 seconds. She does have her skin is warm to the touch, dry, pink throughout. Like I said, there's a few freckles noted. You can note that she does have some moles, but they meet the ABCD criteria. They are not asymmetrical. The borders are regular, no irregularities noted. Color is consistent throughout, a light brown. None of them appear to be darkened, reddened, purple, any colors that are outside of what we would expect to see. Those look okay. Let's see. We could then from here go, we can check the hair. Of course, when you're checking the skin, you can check the hair distribution throughout the body. Her hair distribution seems normal for her gender, her age, her ethnic background. Her hair at this time and the condition it's in appears shiny. I will take, if it's up like this, you would take that down so you can inspect better. You can also feel the scalp and the skull at this time for any abnormalities. Hair appears distributed evenly throughout. It's a lot of hair to dig through. Of course, throughout you can make small talk. That always helps promote your patient to be comfortable and relaxed for this assessment. You can feel the scalp at this time. Just gently press against the scalp for any abnormalities, lesions, lumps, masses. None noted. You can also begin to inspect the ears. Let me get all this out of the way. You can inspect the external ear. Of course, I don't have an otoscope here, so according to our lesson plan, that would be deferred. So you can check the auricle. Again, you can also look for capillary refills. The ears are a little bit pink, but it is pretty warm in here. So that's nothing to be concerned about. They're not abnormally hot. They're warm to the touch. You can also expect the I forget what this is called, the tragus of the ear, and you can inspect the mastoid process for any lymph glands. Those should not be palpable. Again, on the other side, inspect the outside of the ear, which has been well maintained. It's clean to the appearance. No signs of drainage noted. Again, you can inspect for lymph glands. Just gently walk your fingers down the neck, under the jaw. None to be palpated in this area. And while you're here, you can probably inspect for the thyroid gland. Careful not to compress the carotid or the jugular vein at this time. The thyroid gland, like the lymph gland, should not be palpable. I hope I can hear this. Don't feel any abnormalities there. And we will check for the cranial nerve 8, I believe, for hearing. And you can do that by rubbing your fingers and coming in from the side. You'd ask the patient to close their eyes, and you would rub the fingers on one hand and ask which side that, for them to identify what side that's coming from. So if you just tell me what side you hear the sound coming from. Okay, and let's do it again. Okay, cranial nerve 8 appears to be intact. And we can look at the eyes from here, inspect the eyebrows. There's no lesions, scaliness, dryness, evenly distributed. No signs of discoloration. Eyelashes, she is wearing light makeup. Eyelashes are evenly distributed. We can check for, look at the sclera. It is white. There's no signs of yellowing, redness, any abnormalities noted. We can look at the conjunctiva. We can pull down the lower lid. So just going to pull this down gently. It's a pale pink. You can also feel for the lacrimal gland by gently palpating. Of course, if I was in a clinical setting, I'd probably have gloves on, but since this is my daughter, I I trust that she does not have any health issues. Again, pull down the eyelid here. And you can check for pupil accommodation here, which would be cranial nerves 3, 5, and 6 in the following test that we will be doing. I'm going to shine this light in your eyes, so just look right here at the end of my nose. What I'm looking for is constriction of the pupil. Good, it does constrict. That one also constricts. And we can also test the mobility of the eyes by making the patient follow your fingers without moving their head and in the typical H pattern. Excuse me. Of course, throughout I know I'm touching my nose, but if I was in a clinical setting, I would take more caution not to do that. Okay, so just follow my fingers with your eyes without moving your head. You can always take care to place your fingers back into the center point to rest the eyes. We're looking for any abnormalities, of course looking at the color, looking for signs of nystagmus, any other abnormalities, not being able to track. Good, and we will also look for accommodation, and that's where you take an object and have the patient follow it as you go in towards the nose. So just follow this object as I bring it towards your nose. You're also looking for the eyes to constrict. Good. And the acronym that we would use for that is PERLA, pupils equal, round, and reactive to light and accommodation. And at this time we can also, since we're on the head, we can look for, I'm so sorry, I didn't mean to bore you. We can inspect the sinuses. Of course, again, I don't have a scope here, so we will do what we can. We would palpate the temporal sinuses for any pain. Just palpate gently around the area. Feel any tenderness or pain?
No.
Any signs of any fullness or
no?
Okay. You can also transilluminate the glands or the sinuses. You can turn off the light and you can illuminate the sinuses by shining a light through there. I do not see any abnormalities. You can also do this to the temporal sinuses by just shining the light up into the eyebrow. No masses, any abnormalities noted. The sinus is lit up with that nice pretty pink that you're expecting, excuse me. And from here we can check the mouth and the cranial nerve 5. So we see that the lips are appear within normal limits. They are moist, pink. Teeth, dentition seems to be normal. If you can open your mouth for me, just have a look at the teeth. Teeth all appear to be intact. Hygiene is good. We can also check for the gag reflex at this time. Gag reflex is intact. We can, I am recording. You can test the swallowing here if you'll just swallow for me. Again, just gently pushing. You don't want to occlude any of the jugular or the carotid artery. We can also test for smells at this time. So if you'll just close your eyes and tell me what you're smelling.
Vanilla.
Okay. And again.
Peppermint.
Okay. And one last one.
Coffee.
Coffee. Very good. She's got all those right. Those are the typical smells that you would have a patient smell is vanilla, peppermint, and coffee. And you can also have them clench their teeth when she's done yawning. Clench their teeth. You can feel the muscles. Do you ever have any popping or clicking when you clench your teeth or open your mouth? Any headaches in the morning?
No.
This test for the TMJ gland. Can you smile? Smile is symmetrical. And can you puff out your cheeks? Okay, good. The face is symmetrical. Patient appears relaxed, is pleasant and cooperative. And we can begin to test for the neck, range of motion of the neck, and this also tests more of the cranial nerves. So if you can ask the patient to touch the chin to the shoulder, and then to this side, and then can you put the ear, your left ear to your left shoulder? Good. And and your chin to your chest and your chin to the sky. Very good. And have them shrug their shoulders, and this is the cranial nerve 11, and this will test. You can push on their shoulders while you ask them to shrug and try to keep it down, and push your head against my hand. Good. Good. Okay, and from here you can begin to start feeling for the carotids and the jugular gland, or the jugular artery. So if you will turn your head towards me, you can feel for the carotid. Okay, look forward. Good. Good. Perfect. Okay, and at this time I would also listen for a bruit, since I'm there to take care not to overlook that. Just look forward and breathe normal. And a bruit would sound like a whooshing sound. Okay. That sounds normal. And from here we can, oh, I forgot to take her vitals. We will do that. We can check for the thorax and make sure that everything is in normal limits, looking for any abnormalities. Again, this is where we would provide privacy for the patient. Explain to them that you're going to lift up their shirt or the gown and look for symmetry. The chest appears to be symmetrical, no masses, lesions. You can again look for skin color. Skin color looks normal. Thickness appears even throughout. No scarring, no signs of wounds or any other abnormalities at this time. You can percuss the lungs by just gently tapping on your finger. Resonance is what we're listening for. Kind of a nice empty sound. Okay, and you can begin to, if you'll sit up for me. Oh, and then we can feel along the chest wall for any signs of masses, lumps, nodules, tenderness. Okay. Ask the patient to take in some slow, deep breaths while you auscultate the lungs. Of course, take care from going side to side. That way you can compare each side. Good. And then we can look at the back of the chest. Again, kind of look for any masses, lesions, abnormalities. You'd want to make sure that the back is exposed, so you can again look at the skin, inspect. There are some freckles back here. Again, they meet the ABC guidelines, nothing abnormal. You can look at the spine from here, and the spine appears to be straight. We can take the chest towards the bottom of the rib cage, press the skin together, and then have the patient take in a deep breath and see how far it expands out, and that looks for symmetry. Okay, you'll take a deep breath in. Good. The lungs that expand symmetrically. If you'll stand up and where they can see what I'm doing. You'd want to listen to the chest wall in the back. There are a lot of spots back here, so you want to take care to not look for the patient becoming lightheaded, dizzy, having any problems breathing at all on you. So this would be a test that would take just a little while, ensure patient comfort. Of course, as you get lower down in the lungs, you'd want to encourage the patient to breathe just a little deeper. Okay, take a nice deep breath for me. Good. And again. Good. You kind of want to walk it down to the outside of the ribs. Just make sure they're getting into those lower lobes. Nice deep breath. And again. Good. At this point, since the patient is standing up, I could have her bend over and check the alignment of the spinal column, looking for scoliosis, kyphosis, range of motion, any pain. Spine appears to be even, equal. No difficulties bending over. Okay, go ahead and have a seat again. What? Oh, we could have done the Romberg test while she was standing up. Which, okay, so we will have her do that. We can have the patient put their feet together, close their eyes, and you'd look for an abnormal swaying. Of course, you expect some swaying to maintain balance. It checks inner ear. You can have the patient hold out their arms straight to the side. Put your palms to the sky. Okay, it appears to be within normal limits. We can also, let's see. I guess when I was testing, I'm kind of jumping around here a little bit. We can test for number identification by having the patient close their eyes and using a blunt object to write a number in and have them identify that.
Five.
Okay, and then do it on the other side.
3.
Okay, very good. And from here, we did the chest. Sorry, I'm jumping around a little bit. We did the chest. Listen for bruise in the neck. We can inspect the stomach. Hold on, let me put some pillows behind. Is that good? Okay. We can inspect the stomach. Ashley does wear an insulin pump, so we can see the insulin pump site is intact. On a patient like this, you'd want to look for any signs of infection, any areas where it appears to be that they use that pump site too much. Of course, encourage them to use site rotation, so that way they wouldn't get any of that edema, and so that way they don't become resistant to the insulin in that area and keep the skin nice and soft. So I always remember the old Elvis song of "Stop, Look, and Listen, Baby." So when you inspect the stomach, you always stop. And you look first, that way it doesn't create any other abnormal sounds that you don't want to hear. So stomach appears symmetrical, the skin is normal, pink, it appears to be even throughout. The umbilicus is round, doesn't have any drainage, discoloration. And this is where you could listen, stop, look, and listen. You'd want to listen to all 4 quadrants. This can be a lengthy test. It may take up to 5 minutes, and that is absolutely normal. You're just listening for some gurgling, tinkling. Good. And we can palpate the stomach from here. You can do the hook test to feel for the liver. She's a little ticklish, but since she is a little thinner, it is pretty easy to palpate at this point. You may be able to feel the spleen. And you may be able to feel a kidney. You can also listen, we listen for the bruit in the carotid. You can listen for a bruit in the abdominal aorta. I'm choking. Sounds normal, no bruit noted. You can, we palpated, you can auscultate. You would hear dullness or timpani over hollow areas or organs. Excuse me, I need to. I can't pause that. Excuse me. Okay, so we can test for reflexes. Okay, if you'll sit up for me. Quit swooshing the dog. Okay, to test the upper reflexes, just pull the bicep, have the patient relax. There you go. And then you can test a couple inches above that radial artery. Just a gentle tap. Okay, good. Okay, and this side, same, just make sure the patient is relaxed. Tighten the bicep. It may take a time or two to get it in the right spot. Okay. And then you can test the reflexes on the knee. And again, continue to feel for all the arteries. This is the brachial artery. You can work your way down the bicep. Radial. And the popliteal artery. The dorsalis pediis artery. Good. And the other. Good. Just hold my fat as I put it over.
Oh yeah.
Let's see what I forgot. I get to look at my note card one time, I've noticed. Okay, I should have got her vitals when I first came in. Again, I'm a bit nervous, so we can get the vitals.
No,
Get their temperature.
it's clean.
Yeah. You can check for the pulse. Of course, if there's any defects noticed while you are listening to the heart, you'd want to palpate the radial artery. You can obtain the pulse by a few different ways. You can, while you're obtaining it radially, you can look for 10 seconds and multiply by 6, 15 seconds, multiply by 4. You can just count it for a full minute. Pulse is 70 at this time. Temperature is 98.9. Respirations, I always count the respirations and the pulse. Respirations are 16. You can get to get the blood pressure, you want to feel for the artery. Make sure you place the cuff on that area where it tells you to. And to obtain the reading as to where you'd want to go up to, you'd continue to feel that artery until you couldn't feel it anymore. It occludes it and go up another 20 millimeters of mercury. Okay, good. So 140 is where we would go. And then again, you'd want to feel for the artery and place the diaphragm of the blood pressure cuff over that artery. Blood pressure is 106/68. And I forgot to listen to the heart. You can palpate the heart. You'll lay back for me. You want to listen or auscultate, palpate. You want to try to find the apical pulse. Move your way up to the aortic, pulmonic, Erb's point, tricuspid, mitral, and again apical. And that's the same way you'd auscultate. Start with the mitral. Apical, Erb's point, tricuspid, mitral, and apical. Okay, and then we can test for range of motion. You want to go through the joints and all the motion. You're looking for any abnormalities, pain, and feeling or listening for crepitus. So you can move shoulder. Of course, you want to go through the normal range of motion. Bend the elbow, wrist, fingers, and we can have her bend her hip. Golly, grab that. Bend up the hip. Okay, bring it in. Let it fall to the side. Good. And the knee, we can see bends. No crepitus noted. Move the feet around. Okay, and I believe we have got it all. Anyway, thank you so much.